Hi, my name is Alisha Becvar, and I'm going to talk to you about patent ductus arteriosus today. Pathophysiology. Patent ductus arteriosus, or PDA, is a persistent opening between the two major blood vessels, the aorta and the pulmonary artery, as you can see over here. The opening, ductus arteriosus, that you can see right here, is a normal part of the baby's circulatory system in the womb, and it usually closes shortly after birth. And if it remains open, it is then called a patent ductus arteriosus. Etiology. A patent ductus arteriosus occurs more commonly in babies who are born too early than in babies who are full term. A family history of heart defects and other genetic conditions such as Down syndrome increase the risk of having PDA. Other risk factors. Some other risk factors that you may see is a rubella infection during pregnancy, if the infant is born in a high altitude, or if the infant is female. If they're female, they're actually 2 times more likely to develop PDA. Signs and symptoms. Patent ductus arteriosus symptoms may vary with the size of the defect and whether the baby is full term or premature. A small PDA might cause no signs or symptoms and go undetected for quite some time, even into adulthood. A large PDA can cause signs of heart failure soon after birth. Your baby's doctor might first suspect a heart defect during a regular checkup after hearing a heart murmur while listening to your baby's heart through a stethoscope. A large PDA found during infancy or childhood might cause poor eating, which leads to poor growth, sweating with crying or eating, persistent fast breathing or breathlessness, easy tiring, and a rapid heart rate. Diagnosis. The doctor might suspect a patent ductus arteriosus based on a child's heartbeat. A PDA can cause a heart murmur that the doctor might can hear through a stethoscope. If the doctor suspects a heart defect, he or she might request one or more of the following tests: an echocardiogram, a chest x-ray, an electrocardiogram, or a cardiac catheterization. I provided a couple of pictures. This one right here is a infant's x-ray of their chest, and you can see their heart right here. And this is an echocardiogram, and you can actually see the PDA right here. Treatment options. Treatments for patent ductus arteriosus depend on the age of the patient. They will often begin with watchful waiting because PDA does often close on its own. If it does not close, they will turn to medications. In premature babies, NSAIDs may be used, and they block the hormone-like chemicals in the body that keep the PDA open. This, however, will not work in full-term infants, children, or adults. So examples of some medications that they may prescribe would be prostaglandin analogs, antibiotics, or indomethacin. If medications do not work, they may recommend a surgical closure or a catheterization. This is where a catheter is inserted through a blood vessel to close the PDA. This, however, is not suitable for premature infants. Here is the actual device that they insert into the vessel to close the PDA, and you can see from this woman's hand just how small this actual device is, and I just thought that was pretty neat. Nursing assessment. The nurse should assess for weakness, fatigue, dizziness, a sense of pulsing, or even sleep disorders. A circulatory assessment should include history, trigger conditions, history of heart murmurs and palpitations, BP, and pulse pressure. The nurse should also assess for dysphagia and changes in the child's body weight. Nursing interventions. Some nursing interventions that I came up with for patent ductus arteriosus is that the nurse will carefully watch for signs of PDA in premature infants. The nurse will frequently assess vital signs, ECG, electrolyte levels, and intake and output. If an infant receives indomethacin for ductus closure, the nurse will watch for possible adverse effects such as diarrhea, jaundice, bleeding, and renal dysfunction. The nurse will carefully explain all treatments and tests to the parents or caregivers and to the child if they are old enough. Post-operatively, the nurse will closely monitor the patient's vital signs, intake and output, arterial venous pressure, and provide pain relief. Patient goals. Some patient goals for patent ductus arteriosus would be to maintain adequate cardiac output, to reduce the increase in pulmonary vascular resistance, to maintain adequate levels of activity, to provide support for growth and development, and to maintain appropriate weight and height development. Thank you so much for watching. I hope you got something out of this today. I hope you guys have a great Thanksgiving break. Bye. See you Monday.